There are so many different definitions of informatics. In healthcare, it's the intersection of medicine and science and data and computer technology. Graduated from nursing school at the University of Wisconsin-Oshkosh and then practiced as a neurosurgical intensive care nurse out in Albany, New York. And then have been in healthcare ever since, working in a variety of positions from healthcare policy, working for the governor of New York, and then most recently as the Vice President of Health Informatics at Aurora Healthcare, until I was recruited to take on this new role to lead up the implementation of Epic at Advocate Aurora Health. I get that all out from my students. Is in the beginning of the year, it's like, what's this informatics stuff? I don't need it. I'm a nurse. I'm just on the floor taking good care of my patients or running my unit. And what I'll tell them is, because of the technology and the data that's now available, that knowing how the technology works and how the data is collected and how the data can be used is a vital part of practicing healthcare in a modern facility. Healthcare has become more digital in the last few years. It had been largely a paper-based industry. And so what we've done now that we've digitized so much of healthcare through electronic medical records, there's a mountain of data. So informatics helps us understand how do we understand what's happening with a patient from the data that's being collected, and how do we make better decisions for the care of that patient. A really good example would be if a doctor orders a medicine and that patient is on another medicine, the technology can tell us, hey, that medicine's going to interact badly with that other medicine, and we can warn that doctor to not make that order of that or that prescription for that medicine and have them change what medicine they were thinking about ordering. There's also a lot of things that happen in healthcare that I think people take for granted that's largely driven by clinical informatics, and that is when we implement new technology. Say we have a new video or a filming system within an OR suite. That's all really about getting more data and getting more inputs. And the projects that we implement in healthcare need clinicians in driving those projects. It can't be computer people or geeks doing it. It has to be clinicians. And the best clinicians that help with these projects and drive best decisions about what technology is used are those that have a solid understanding of data science, computer technology, and their clinical area, and that's really the world of informatics. And I think it's really important to have the patient perspective on this, because patients are increasingly involved in their care. They're looking at their medical record on their phone. They're asking questions about the data that's in their phone that is being transferred from electronic medical records, and they are helping clinicians make better decisions based on the questions that they're asking, based on the technology and the access that they have to that data. So it's just a vital part of healthcare today. Data, computer science, technology is all part of just modern healthcare in the United States and frankly around the world.